Okay, everybody, it's 4:30 and I'm told we have a quorum. Jeffra, I know you can see everybody who is on the call on the Zoom. Do you have all the phone numbers so that you know who those numbers represent?
Yes, I do.
Okay, great. So our meeting is called to order. We'll dispense with the reading of the minutes unless there are any additions, deletions, or corrections. Are there any? We'll move forward then to the board presentation, and I'll turn the Zoom camera over to Karen Zemansky with regard to Buffalo Rising Against Violence. Karen?
Thank you very much. In 2019, ECMC decided to seek federal grant to enhance our trauma program. And we did obtain the grant. Next slide, Jeffra. We did obtain the grant in 2019. So what did we do with this grant? We established an in-house model to provide psychosocial services to our patients and families 24/7 for victims of violence. We received an additional social worker from community organizations to assist in our effort. We established long-term case management post-discharge, and we established a domestic violence liaison for New York State Office for the Prevention of Violence. Next slide. So up to today, we have seen 706 patients served by our BRAVE program, 208 gunshot wounds, 99 stabbings, 193 victims of domestic violence, and 85 sexual assaults with SANE exams completed. Next slide. We have worked with our grant to also create new initiatives and collaborations with many other organizations to help victims of violence in many different ways. Some of it is victim restitution. Some of it is funeral expenses. We're collaborating with primary care, the Youth Center of Wellness for Victims of Violence, domestic violence and elder abuse screening with ECMC's primary care and orthopedic clinic, collaboration with elder abuse with Center for Elder Law and Justice regarding elder abuse. We've partnered with CPEP in our inpatient psychiatric units in terms of comorbidities of violence and mental health. We've partnered with our AIS and detox programs to also collaborate with patients at risk for violence in relation to addiction. We have started a burn support group, which we initiated in September of 2020, that supports domestic violence and also victims of SANE and any other violence that has resulted in burns. We have started a DBT therapy skills group for patients with trauma history, initiated in September of 2020. We have also started a pilot program screening for family violence in hepatitis C clinic. One of the other items that we utilize our funds for is for our SANE nurses. We're able to utilize our education for them. When we didn't have the pandemic, we were able to send them to Quantico and be able to participate in the education there so that if a SANE victim came to ECMC, we would be able to provide the highest standard that we can for that patient, and that the evidence collected could be utilized to bring the perpetrator to justice. We also did a pilot program screening for family violence in the hepatitis C clinic, and a victim of violence clothing bank and diverse cosmetic depository for patients has been established also. The amount of items that we have been able to enhance our program have been unbelievable in terms of what we've been able to do. And this is even within the pandemic that we are moving forward. This amount of funding has really created a touch point for our patients and their families from the moment they come into the door at ECMC, not only even when they leave, but afterwards. We're able to help and assist them in so many different ways that they are responding back to us that we have been a major form of support through what is obviously a very traumatic time in their life. Thank you for allowing me to present.
And John, I just want to thank Karen for her leadership with this program. Obviously, this month is Domestic Violence Awareness Month, and we thought it was important that the board saw the efforts being done to support our community. But it's because of Karen's efforts and working with law enforcement that we were able to really take this program to the next level. So just kudos to Karen and her team for everything they've done with regard to the BRAVE program.
Thank you, Karen. Are there any questions for Karen before we move on?
Yeah, Karen, are there any crossover between SNUG and what you're doing?
100%. We are very aligned with SNUG. In fact, SNUG is the organization that has assisted us with the social worker. We're very aligned with SNUG.
Yeah. Oh, thank you.
Further questions? Okay, thanks everybody, and Karen, thank you again, and please keep us posted as the progress continues.
Thank you.
We have a number of actually 2 resolutions for us as a board to consider. The first is, as we typically do, the approval of service contracts. Ms. Persico.
Thank you, Chair. The Contracts Committee met on October 21st to discuss contracts in excess of 1 year, which were occurred during July 1st, 2020 and September 30th, 2020. The committee reviewed all of the contracts. I think in your board materials, you have a listing of the contracts. The committee reviewed those contracts and has recommended to the board that the corporation approve and ratify the applicable contracts. But if anyone has any questions, I'm happy to answer the same.
Questions for Jen? Jen has made the motion. Is there a second?
I'll second. Amen.
Thank you. Further discussion? There's no further discussion. Please signify by saying aye if you approve the motion. All in favor?
Aye.
And opposed? That motion carries unanimously. Second resolution, I believe Dr. Flynn is on the Zoom.
I don't think so.
Dr. Flynn is not. How about Dr. Murray?
Yes.
Hi, Dr. Murray.
This, I take it, is the to receive and file the minutes of the Credentials Committee meeting of October 1st, 2020, which was approved yesterday by the Medical Executive Committee. It featured 13 new providers in a variety of departments, stretching from family medicine to pathology, 40 reappointments and 7 resignations. Just mentioned among the resignations was Dr. Howard Davis, who has formerly served as our Chief of Service of Anesthesiology here and has been of service to the hospital for many years. Otherwise, it was routine business, nothing that I feel I need to bring to the board's attention.
Great. Thank you, Dr. Murray. So Dr. Murray will make that motion. Is there a second?
Actually, somebody else will have to make the motion. Ex officio.
We want you to make the motion, Dr. Murray. But-
I'm happy to make the motion, Doctor.
I'll second.
Thank you, Jen. Motion's been made and seconded. All in favor signify by saying aye, please.
Aye.
And
Aye.
opposed. Thank you. Dr. Quattrochi, CEO report.
Okay, I'm going to try to share my screen here, see how this works. I don't think this is it, Jeffra. That one. That working?
Yeah, working for me.
All right, sounds good.
False
She was coming in here to rescue me, so. Let me make sure that door shuts. Okay, there we go. All right. I'm very proud to announce a new team at Terrace View, who all these individuals are on the phone. I'm going to ask them to very quickly introduce themselves. As you know, Anthony DePinto left Terrace View to take another position. And we also have new medical directorship, which we're very excited about for Terrace View with Dr. Shields and Dr. Williams. But Michelle Krause comes to us from Fox Run and is doing a phenomenal job right off the get-go. So I'd like to just have Michelle introduce herself to us, and then Dr. Shields, and then Dr. Williams. Go ahead, Michelle. Oh, Michelle?
You're on mute, Michelle.
Okay.
Mute.
Hello, everybody. I don't know if, can you hear me okay?
Yes.
Okay.
hear
We have an alarm going off in the back, so that's why. But I'm so happy to be here. Today is actually my second week, so just kind of jumping right in. And I look so forward to meeting all of you and all the things that are going to be happening here at Terrace View. So thank you so much for this opportunity. Thank you.
Welcome, Michelle.
Well, thank you.
Welcome, Michelle.
Thank you so much.
Dr. Shields?
Hi, thank you for the opportunity. I'm Paul Shields. I've been in Western New York now for 1 year as of November 1st. And we came under the guise of the Great Lakes Integrated Health Network to improve the process of a comprehensive post-acute network. And part of that is to optimize the management of your licensed long-term and subacute beds. And we're very excited to be on board as of November 1st, managing clinically. We're excited to come into Terrace View. We think that it's a great foundation to improve upon. And we feel that by working cooperatively with the hospital and working as a streamlined process to throughput patients efficiently and continue them on a longitudinal process to the least restrictive level of care, we can be very successful in the community. In addition to Terrace View and in benefit to ECMC, we additionally manage 1,400 licensed beds in community long-term and subacute facilities. Our goal through 2021 is to develop a high-performing network of affiliated and unaffiliated community partners so that the hospital can see benefit in length of stay as well as optimization of metrics that are challenging from a compensation and reimbursement standpoint, including 30-day readmissions and unnecessary ED utilization. We're hoping to work to optimize the care that's provided both at Terrace View and in the community buildings that we're managing. So I appreciate the opportunity. And if you ever have an opportunity to need assistance in the post-acute space, whether it be through home health care or congregate living, feel free to reach out to me. I am happy to get involved in any cases that reach a challenge and start to stagnate the process of longitudinal improvement. So thank you.
Thank you, Dr. Shields. Where did you come from?
I spent the last 22 years in Western Pennsylvania, the last 6 working for Allegheny Health Network, developing a comprehensive post-acute strategy for integrated healthcare finance and delivery system.
So you were in a battleground state.
I was in a battleground state. Yeah, my kids still live there, so hopefully they vote.
I won't ask you.
What's that?
I won't ask you the obvious, but welcome.
Thank you. I'm looking for continued improvement.
One can only hope. Dr. Williams?
Hello, I'm Dr. Cassandra Williams. I guess I'm what you would call a boomerang. I'm actually from Buffalo, New York, and went to medical school at University at Buffalo. Left for training and did 12 years in hospital medicine in North Carolina, and recently returned home to Buffalo. And
Good for you. Welcome home.
Thank you. And started back there at Terrace View, actually with the other staffing company that was there. But GPCC has graciously agreed to keep me on, and I'm happy about that because I do enjoy what I'm doing at Terrace View. So I look forward to Dr. Shield coming on and being able to continue to improve things there. So thank you for welcoming me.
We're thrilled to have you. Did you say North Carolina or South Carolina?
North Carolina, right outside of Charlotte.
Uh-oh. Okay, I won't go there either.
Where are we getting these people from, John? Come on.
I'm a New Yorker. I'm a New Yorker.
Welcome.
Well, as you can see, we're very excited about all these individuals and their leadership for Terrace View. As you know, we have great care at Terrace View, and we're looking to take it to the next level. So thank you very much for introductions, and we look forward to hearing more great things. So thank you.
Well, we'll look forward to meeting Dr. Williams and Dr. Shields and Michelle personally when all of this is over.
Yes.
I just got a notice on my computer that it's going to restart in 14 minutes. So I don't know if that's them giving me a timer for my presentation, but I think John might have organized that, but we'll see how this goes. Jeffrey, is my computer working here?
Well, as long as Peter Cutler doesn't speak, 14 minutes should get you done.
Yeah. Oh, here we go. All right. Are you seeing the quality slide? Is everybody seeing that?
Yep.
Yes.
All right. Perfect. Okay. To date, we have had 300 COVID patients, 128 who have been female, 172 who have been male, with an average length of stay of 15 days. We currently have 4 patients in-house. That's been fluctuating anywhere from 4 or 5 to 10. It's actually been going down slightly in the past week, which is obviously good news. Although I know some of the hospitalizations have been going up in other parts of Western New York. We have 1 patient who's vented, 0 patients under investigation right now, which basically obviously means they're waiting for a test to come back, and negative test to date is 62,000 that we've conducted. Hospital-associated infections, we continue to monitor our hospital-acquired infections on our journey to 0. We have had 11 CAUTIs to date and 7 central line infections, 3 of whom have been positive. So that's obviously complicated those numbers since obviously it's a respiratory and inflammatory disease, COVID is. We have done very well on some of our measurements for CMS and for our healthcare companies that we work with. And I just want to point out a couple areas in which we earned 100% of our quality initiatives. And, these dollars can be in the range of hundreds of thousands of dollars. So again, very, very important, and the team's doing a great job, and Donna Jones, as well as Dr. Maureen Karen and Jim Turner on the outpatient side for all of this. Just a couple notes of some individuals who have been participating in region-wide and national organizations for our organization, and continuing to get the good word out about ECMC. So I just wanted to feature some of those. I mentioned this in an email to you that Donna Gotti and Deborah Heigl were chosen for a Robert Wood Johnson Foundation Fellows Award for the homeless. Renee Delmont, unit manager, she received our first Daisy Leader Award for the second quarter. So many of you may know Renee, who does a wonderful job in our orthopedic unit. Our patient experience scores have gone down slightly. This is actually a national phenomenon right now with COVID, and there's many, many reasons for that, but Donna, if you could just very quickly cover what you've been hearing nationally regarding patient experience scores, because I think it's pertinent for this discussion.
Sure. Thank you, Tom, and good afternoon, everyone. So really just to kind of briefly highlight a couple of areas that we've been talking about nationally. And one of the greatest impacts that we've seen is around the limitation of visitation for patients, and having their families really be at the bedside with them as part of the care team has really impacted what we're seeing in the scores. Not only for patients, but additionally for the care team, nurses, the doctors who are accustomed to having that extended family there to help support the care of the patient. Also dealing with fear and anxiety, mental and physical exhaustion during treatment, lack of understanding regarding the virus and the treatment, concern for their safety in terms of how can the hospital, can they help to keep me safe, in the midst of the pandemic, and then how will the virus impact me once I leave the hospital? So a lot of that is playing in to what we see in terms of the score. But one of the things that really stands out, which unfortunately the survey really doesn't measure, is the kindness and the compassion that has come from the pandemic in terms of the treatment that patients are receiving. So unfortunately, the survey doesn't speak to, the kindness of someone. It asks, how often is something being accomplished? But that's one of the key things that we're seeing in the data in terms of kindness, communication, courtesy, and respect. So more to come. As we know, the first and second quarter scores, CMS has decided to table those for now. They were talking about eliminating the third and fourth quarters as well. So we're still waiting to hear back on that.
Donna, where is our opportunity here? I'm understanding that we've got some issues that are not necessarily in our control. Where does our focus need to be now in order to move these numbers?
Sure. So thank you, John. And in order to move the numbers, we're going back to, really back to basics. Focusing again on communication. That seems to be an area of opportunity in terms of staff communication, responsiveness, things along that line that we can really dial back into. So those are the areas that we will focus on. Medication is one that Karen and I we put an interdisciplinary team together around that that we'll be focusing on as well.
So you guys are addressing the issues and seeing what we can do to keep those numbers as high as where we want them to be?
Absolutely.
Great.
Great. Thank you, John. Thank you.
You're welcome.
Also during obviously this time, we're continuing our training, both for our patient advocates as well as our staff around patient experience. So these are some examples of trainings that we've been attending. Around culture, obviously diversity and inclusion continues to be a priority of ours. And I wanted to make sure that the board had a chance to see kind of the areas in which we are focusing. I know we've talked about this at many of our meetings, and we are launching a communication to our entire community here at ECMC. And as you can see, this is the flyer that the Office of Diversity and Inclusion and the committee put together for the campus to obviously communicate our priorities for diversity and inclusion. So Andy has been doing a great job, obviously, with Cindy Bass and the team. And at the next meeting in November, we're going to have Cindy do a presentation on our efforts and how our progress around diversity and inclusion.
And we're going to do our own training for the board, correct, Tom?
Correct, and we're going to try to figure that out, obviously in the era here of COVID, but we will figure that out and make sure that we'll split the group, maybe the board into 2 groups or something like that, but we'll figure that out.
So I would ask the board members to get ready for at least a couple of hour commitment to do the training at some point before the end of the year, once we can figure out the timing.
Yeah, and we want to try to do it if we can in person. We'll have to see how things are going. Obviously, it's more impactful when it's in person, so that would be our preference if we can. Like I said, we may do 2 groups here with the board of directors.
Great, thank you.
Yeah, thank you. In Newsweek, Terrace View was recognized. They studied about 10,000 nursing homes across the country, and Terrace View was found to be high performing around the COVID pandemic on response. They chose 400 out of the 10,000 and give Terrace View that recognition. So congratulations again to Terrace View for keeping our employees and our patients, residents safe during the crisis. We are now able to illuminate our letters in different colors to recognize different awareness months or recognitions. So obviously I mentioned Domestic Violence Awareness Month is this month, so we illuminated our building in purple. We illuminated it in pink for National Breast Cancer Awareness Month. And we have a lot of celebrations this month. October seems to be the month for awareness and recognition, as well as celebrations. So just a smattering of some of those, and we celebrated. And for instance, with pharmacy, Andy and I went and talked to the team, but a busy month. This is an interesting project. This is a hearing room that we created on our 5th floor so that we do not need to transport patients to the courthouse. And in many instances, especially with some behavioral health patients that were recovering or under treatment, it could be a safety issue for our team and obviously very traumatic for the patients. So Karen and her team, as well as Andy and others, led an initiative with the court system and Tony Colucci to create this court on our 5th floor. So we're very excited about it, but I thought the board might want to see what that hearing room looked like. Our window project continues, and it's on time, other than a little rain that set us back. So kudos to Jim and his team for all the work that they've been doing. The ER ramp demolition is complete. When we did the windows, we also refreshed the burn unit and did some new paint and those types of things. And also, we have a couple other initiatives going on around digital health. So we're going to be starting to upgrade our website as well as some of our technology. So we're starting actually a chat bot. You may be familiar with some of those, some retail or banking that you might have done personally where you've used a chat box. We're going to have a system to do that, to talk to our patients and guide them through our website. And then finally, we have a technology called Vocera that we're launching, and it's a communication technology to make communication more real time and response more real time. So I'm gonna turn it over to Pam Lee just to talk a little bit about Vocera and the importance of it in our organization. Go ahead, Pam.
Okay. Hello, everyone. Yes, as Tom was saying, we've just implemented Vocera technology, beginning to roll it out. The staff are very thrilled. It's hands-free wireless technology that's used to communicate. We're putting it into the hands of all of support services, as well as some clinical areas as well. Eventually, the ED and throughout the house, Vocera technology will be implemented. It's very good technology in the sense that just contemporaneously, staff are able to communicate with each other. From a support services standpoint, housekeepers can be contacted, and there's the capabilities in the technology so that if any particular person who's carrying one doesn't respond, then the communication need will be bumped up to the next person, all the way to senior management if the desire is to have it to be bumped up in that fashion. So we're pretty excited about it. It's definitely something that's going to help us to gain efficiencies throughout the organization. We'll be able to better, again, communicate with one another and identify things that are in the environment that need to be taken care of and momentarily have those things taken care of. And so we're pretty excited about it and just looking forward to the continued implementation.
Okay, thank you, Pam.
You're welcome.
And that's really exciting. Will that get Mr. Colucci to return phone calls more quickly?
I don't know about that.
It's not a miracle worker, it's just technology.
Yes, yes.
This is Andy. Just to kind of piggyback on what Pam said, we actually saw this a few years ago over at the Cleveland Clinic when we actually went to look at the huddle process. So, thank Pam and also Karen, who we both serve in the ED, and I think this will enhance not only the patient experience, but just our process and throughput and communication.
Thanks, Andy.
All right, John's trying to make sure my computer doesn't shut off here, John Cumbo. So I'm going to let John Swiatowski cover the volume slides. And I need you, Jeffrey, to take over my slides here.
I think she's got it, Tom. Thank you. Just moving right into the operational and then the finance discussion, I'll take over where Tom left off. And as you can see here, there's quite a bit of green. So we've made some continued positive steps on the road to our longer term recovery this month, in the month of September, that you see in front of you, specifically on the volume and in some of the expense areas that I'll talk about. But the story for the month is that revenue is continuing to improve, driven in large part by the volume that you see here. But we're still incurring COVID costs. But specifically, when you look at the operating statistics, you can see that our inpatient cases for this month were in excess of our budget and our 2019 performance by a little, roughly between 6 and 7%, which is quite a significant change from what we had been reporting for months back to March. So we're very pleased with some of the recovery here, and I'll talk a little bit about that in some more detail in a moment. But just a couple other things to note on this page before we move to the next is that we continue to manage the length of stay very efficiently and effectively. You can see here that both the total average length of stay and the acute average length of stay are below budget and below last year's levels. And this is not by accident, but by concerted efforts on the part of our medical staff, as well as our managers in those areas and our utilization and case management teams led by both Dr. Murray and Karen Zemansky in large part. So big kudos to them, because that really is a concerted effort that I know we've talked about in the past. A couple other things to highlight here before I move on is that our admissions from the emergency department continue to be strong. They're stronger than our plan and last year. We are seeing sicker patients within the emergency department that are requiring admission. So that's leading to what you see above. And then lastly, on this page, I'll just touch on the surgeries because I'll talk about it in a minute. But when you look at our overall inpatient discharges are over plan, as are our total surgeries. But when you look a little deeper into our inpatient surgeries versus outpatient, you can see here that our inpatient are a bit behind plan and our outpatient are a bit above plan. So what we are seeing is a bit of a shift, both within the market, generally speaking, but also here at ECMC, shift between inpatient, what traditionally had been done as inpatient, that are shifting to the outpatient. That's going to continue as we go into next year. We've planned for that to some degree in the budget. And we're monitoring that to try to understand if it's really being driven by the payers, which we do believe some of that is, but also being driven by physician preference, as well as now in some ways consumer driven. So that is a shift. Overall surgeries is being up, but it will have an impact on our revenue. And so when we look at, on the next slide, a snapshot, this is a new slide that we're providing to the board, but really a snapshot of kind of what we look at financially on on a daily basis and monthly basis. And just to show the board in one slide, both the month and the actual year to date and how we're doing. And so what all the drivers that I just described led to for the month was, again, a more positive month than we've seen in the past. And this top line shows that in terms of operating performance. So our overall net loss with the CARES Act relief funds was a net of $524,000 loss. And then year to date on the actual side, it was roughly, that brings us to about 39.5 million. And so again, much improved over prior months. And actually this month, it fell in line actually with our operating plan for this month. And that's, again, in large part driven by the green that you see below it, both in length of stay, discharges, surgeries, as well as FTE management, which I'll talk about now. As I mentioned last month when we reviewed the operating plan and capital plan for 2021, we have a target of FTEs in that plan that require us, or that will require us to operate and manage those FTEs through vacancy management and efficiency and effectiveness in doing so. Our target was 3,462, but we started at about 3,592. So we've been moving the needle through that vacancy management, whether it's through retirements or people leaving the organization. And so you can see here that we're already down into 3,545. And again, that will fluctuate up and down as we have the need for individuals for care-related purposes. But on a whole, we're really trying to start now so that we can be ready once January 1st hits in 2021. And so the next two slides really are just what you're used to seeing in terms of our financial performance. It's the monthly financial performance and year to date. And really what this is showing is what I just described. You can see the $524,000 loss in or around the middle of the page. And that compares to a budget for the month of a $580,000 loss. Again, that does include CARES Act funding relief of about 2.7 million, but included in our expenses is CARES Act funding relief related expenses and other COVID and one-time costs. We're estimating our COVID costs just on the expense side for supplies and staffing to be in excess of $1 million just for the month. And that doesn't necessarily include any other revenue components where we're still lagging in certain revenue areas like therapies or outpatient visits in our clinics related to the COVID pandemic. So I think all in all, it's a fairly positive month and on a trend that we had been seeing, go the other way throughout the beginning part of the year. And again, on the next slide, it just shows, again, the year-to-date performance that I referenced. And that would include a $39.5 million loss, but includes $44.1 million of CARES Act relief funding. I'll talk a little bit more about what's going on in the landscape of the CARES Act relief in a few minutes. But this really does show you really just an up-to-date snapshot picture through September of where the organization stands financially on the income statement. The next slide will just give you our usual snapshot. We're still continuing to track all of our COVID-related costs. That would include all our lost revenue, as well as any additional costs that continue to be incurred. And so I mentioned the costs related to the current month. And what we did see in the current month was a significant uptick in our costs related to supplies. For those of you who are familiar with what's been happening in New York as it relates to PPE, September 30th was the deadline for the hospitals and nursing homes in New York State to maintain, build up and have on hand an inventory of PPE supplies that's the equivalent of 60 days for the nursing home and 90 days for the hospitals. And so in order to do that, we did have to incur additional expenses, although I will say our team here had enacted that plan several months ago in anticipation of that deadline. We didn't have too far to go, but still had to incur some additional costs that really drove up some of the supply costs in the current month. But all told, we're running at, through September 30th, about $77.2 million of total costs related to the COVID-19 pandemic. And so just to give you a few updates on the next slide as it relates to the CARES Act relief, but also some of the other items as we kind of head down the road towards year end. When we last met, we had not yet heard any new news on what was happening in the CARES Act relief funding realm. We knew and still continue to know that there are discussions happening today and as there were last month, with no success on a new bill. However, when we last met, I mentioned that there was a little over $58 billion of CARES Act relief funds that were previously approved in the prior bills that had just yet been undistributed. And since that point, HHS, the Health and Human Services Department, has essentially carved out 20 billion of that to provide a general distribution in what they call phase 3. That phase 3 distribution will first go to those organizations, providers, hospitals, dental providers, physician groups, physician providers, FQHCs, all of the providers in the country who have not yet received their initial general distribution in totality, which is roughly 2% of their revenue. The next phase of that, they would say anything that's left will essentially be added on, and you could apply for these extra dollars, and they will potentially distribute additional monies to those areas and those providers that can essentially display that they have increased expenses and lost revenue in excess of where they were last year. And so we're in the process of providing that application. That application is due November 6th, but we'll have that done within the next week just to get that into the process, because those will be distributed on a rolling basis. If you were to ask me whether or not we'll get any funding, it's really unknown, because they have not yet really provided any further details on whether or not there will even be anything left for the add-on payment outside of the 2%. So more to come on that. The other item, other couple things I'll note here, the Medicare loan. So you may recall we have roughly $37 million of loans related to the Medicare Advance Payment Program, which we took advantage of early on in the pandemic to make sure we bolstered our cash position. There's roughly 6 months of Medicare fee-for-service payments that they offered to providers. We've retained that cash prior to the continuing resolution that the government signed in October. Those funds would have had to have started to been paid back now and then paid back by year end. Instead, what they've done is they've approved in the continuing resolution new terms, which would allow for us as well as all the other providers to not have to start paying that back until April of 2021, or a year after you initially got the funds, and then allow for a year payback of those funds before an interest rate of about 4% kicked in. So good. It's really, really solid change for us and all the providers who were facing these immediate paybacks. But nonetheless, it's dollars that we can at least take advantage of for a period of time, but will have to be paid back next year. The last thing I'll mention is, as we move and shift our thinking into year end, I know last month when we were together, I did talk a little bit about the COVID impacts of the pandemic on the timing of our pension expense calculation and how that played into that. That nothing significant has changed. We are still expecting $30+ million income statement unfavorable expense adjustment for that by year end, just based on the timing of when that had to be valued, which was March 31st. But we are looking at the retiree health expense. As you know, we have a plan that allows for retiree health to continue for those retirees in certain classes. And the same thing will apply, although that valuation date won't occur until December. So more to come on that, but we do expect, just given dynamics in the market, along with interest rates, that that will have an unfavorable impact as well. And then lastly, what we are understanding is there is a payment reduction for all of the public nursing homes that's been calculated by CMS, all the public nursing homes in New York State, related to the upper payment limit payment. That we're still getting more information on, but the preliminary information has shown us that there will be a reduction in that payment, so it will impact cash flow this year. And then as we get into year end, will certainly have an impact on overall revenue related to that in the nursing home. We are going through a significant amount of advocacy on that, along with all the other public nursing homes, as well as our associations and the nursing home associations. But right now, that's where it stands. It's in the advocacy component of that fight. And we'll continue to work that angle, but we have to plan for it in the meantime. I think just to close this out, the good news is we've been able to maintain a very strong cash position throughout the pandemic. As you can see here, it's about 110 days cash, and that's all in. That includes designated assets, but certainly something we're keeping our eye on a weekly and daily basis as we continue to move through this year and into next year. And with that, John, I'll stop for questions. If there are any.
Questions for John?
This is Sharon. I just want to compliment not only John, but the entire leadership team. It has been absolutely phenomenal the way they've been able to run things through during this COVID operation that we've been forced to live in over the past several months. And John, I want you to know that I'm pulling for you to get more of that money that's out there. And maybe we'll have to wait a couple of weeks to find out if it's going to really come to fruition.
Well, you will be the first to know as the board.
Thank you very much.
Well, Tom will be the first to know, and then the board.
So long as we get the word, that's the most important part.
That's right.
Good catch, John. Any other questions for John? The one point I would add is I've asked John to put together that dashboard that you saw. I think it was the third slide from the end. We're going to continue to work to refine that so that we can give the board an accurate snapshot of those 4 or 5 metrics that seem to be the most important. So if you, it's still a work in progress and we continue to refine it, but if you have any suggestions as to what needs to be included, please let John or myself know. We're gonna continue to create this, what will be an elevator speech, if you will, for our financial performance. Any other questions for John or Tom or myself at this point? Okay, our committee reports quickly. The most relevant and most important thing that I would share with you all is that earlier this week, the executive committee, the compensation committee met and approved an extension for Dr. Quattrocchi's contract through 12/31/24. So I'm thrilled to report that the negotiations, while difficult,
Yeah, right.
the negotiations were done in the same way that Tom has managed the hospital. I will tell you that the board response to his performance evaluation survey was absolutely off the chart, and it made the rest of the conversation quite easy. I'm not quite sure, how he's going to be able to improve those scores, and that was based upon the information that you all provided to us, and as I say, the scores were spectacular. Mr. Colucci, do you want to comment further, other than to say congratulations?
Only to point out that we followed the usual procedure that we have followed in the past in terms of submitting evaluations to all board members and receiving back about 2/3 of those requested filled out the form. Your characterization of the scores was correct. The term of his contract through the end of 2024 was actually in place already, and we delayed some of the payment. Tom, faced with the challenges that the hospital's been faced with this year, asked the Executive Compensation Committee to delay some of what he would have been entitled to in the way of compensation adjustments, which the committee embraced and pushed those out 12 months. I don't think I need to get into too many of the details in that regard, but the committee's comment on that was it was emblematic of his leadership. So.
Thank you, Tony, and Tom. Thank you on behalf of the entire board. Thank you for the great work that you and your team do, and we're thrilled that we've been able to reach this agreement for the next 4 years. So congratulations.
Well, thank you for the support, and thank you to my team. These are the ones that do the lion's share of the work in my view. So I appreciate it.
I'll resist the temptation to say anything other than thank you. Great job, and great job to everybody. Finance Committee, Mike Seaman, anything to further report, Michael?
No, I think John, John did a great job in identifying everything, but the most important and the most difficult thing is the uncertainties that lie ahead that makes it really tough to do budgets and stay within budget. So again, kudos to Tom and his executive team for doing a great job and doing what they need to do to get this job done.
Thank you, Mike. Questions for Mike Seaman? Jen Bursico on contracts.
I thought we addressed that resolution, but in the event that we have not, did we? Am I right, or am I crazy?
No.
Either one is a possibility.
No.
Both are true.
Not in that order. Anything further? Yeah, we'll move on, Jen. Thank you.
Okay.
QI and pace and safety, Mike Hoffert.
I would suggest everyone check out the reports. It was another great meeting. Unless Karen wants to make any comments on her presentation and the nursing stuff. No. Thank you, John.
Okay, thank you, Mike. I would now be happy to take a motion to go into executive session for a report by Dr. Philidoro. Is there such a motion?
So moved.
Motion's been made. Is there a second?
Ben.
Who was the second?
Dr. Graham.
Thank you, Katie. All in favor?
Aye.
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 Okay, let's take. John, could you get us back into our public domain?
I've already taken care of it.
So we're back publicly?
Yes, you're back publicly now, thanks.
Okay, great. So at this point, please everyone stay safe, and we'll see you next month, and then we are adjourned. Thanks,
Thank you,
everybody.
John.
Bye, everybody.
Be well.
Take care.
Aye.